Bismillahirrahmanirrahim. Quote of the day: He who has health has hope, and he who has hope has everything. Today, the topic of my presentation is health sector reforms, and I'm presenting it under supervision of my professor, Dr. Sarah Afzal. Learning outlines of my presentation are reform outside the healthcare system, reform within the healthcare system, the gateway health policies cover, the reform agenda. Learning outcome. At the end of this presentation, the participants would be able to describe the reforms outside and within the health care system and the reform agenda. Now, what are health sector reforms? Health sector reform is a sustained process of fundamental change in policies and institutional arrangements of the health sector, usually guided by the government. The process lays down a set of policy measures covering the four main functions of the health system: governance, provision, financing, and resource generation. It is aimed at improving the functioning and performance of the health sector and ultimately the health status of the population. Health sector reform deals with equity, efficiency, quality, financing, and sustainability in the provision of healthcare and also in defining the priorities, refining the policies, and reforming the institutions through which policies are implemented. First is reform outside the healthcare system. It consists of structural reform of the state and health, and second is social policy reform and health. The structural reform of the state and health. Health reform is not a sectoral phenomenon. It has related policy, regulatory, institutional, and legislative dimensions. Health reform is deeply interlinked with macroeconomic management, effectiveness of governance at state level, and social sector process. These factors have more sustained impact as compared to isolated planning within health sector. Structural reforms of state governance have significant effect on the performance of health system. The need is to bring about improvements in public financial management and procurement, civil service and audit systems. Pakistan has started many initiatives to assist with systemic reform. The evolution of Government Initiative 2001 include e-governance initiative, automation of Central Board of Revenue, electronic procurement reforms, and reform initiatives of Public Service Commission. Important aspects of state reforms. These are: first is promotion of transparency in order to counter the well institutionalized pattern of corruption, which is corrupt practices and lack of effective accountability mechanism by anti-corruption reforms. And anti-corruption reform is a huge agenda and can be categorized into planning strategically and reviving the dormant national anti-corruption strategy. Second is bridge gaps in institutional mechanism relevant to anti-corruption reform. These oversight institutions include the Public Accounts Committee and Auditor General Department needs to be strengthened as tool of accountability. In relation to investigative work, National Accountability Bureau is transformed into Accountability Commission. This new institution should be strengthened to engage the impartial pursuits. Third is to institutionalize integrity promoting measures in the public sector to promote transparency in governance in case of access to justice project, the project to improve financial reporting and auditing and other similar efforts. Certain implicit transparency building measures should be prioritized. The use of technology can enable plugging leakages from system, obviating unauthorized payments and promoting transparency in procurements. Fifth is to focus on disclosure and build safeguards against conflict of interest in civil action, judiciary, and political party finance. Second important aspect is to reforms of political institutions, strengthening systems of judicial redress, mechanism of civil society oversight, ensuring freedom of information and open media. This is a picture taken from the Sania Nishtar book showing impact of broader governance from reform on reform within the health sector. These three, that is macroeconomic reform, tax reform, fiscal responsibility, and debt limitation, all three leads to the increase in fiscal space, leading to increased resource for the health sector and improved performance of the health system, and ultimately leading to improved health status. Also, macroeconomic reform leads to growth, job creation, economic supplementation, leading to improved social determinants of health and ultimately leading to improved health status. Second is social policy reform and health. Social policy and health outcomes. The Commission on Social Determinants has firmly established that inequities in daily living conditions and inequitable distribution of power, money, resources are among the most important determinations of health status achievement. Social policy construct and social impact is through variety of pathways are given below. First is health has a direct correlation with poverty, illiteracy, and inequities in society. Well-established best determinant of health status achievement is the level of per capita income. Second is much of the scope of public health workers is conventionally outside medical care, including provision of clean water, solid waste disposal, ensuring food security, occupational health and safety, safer work and living environments, securing safe neighborhoods, health status achievement, but not within the remit of health sector. Third is within the healthcare system itself, particularly the mixed health system, the role of state in health can be reinforced if it acts as intersectorally to ensure that health is delivered as a common good, not as market commodity. In Pakistan, 73.38% population is not covered for health. Health shocks are the commonest catastrophic faced by poor households in Pakistan. This is the figure showing the prevalence of different categories of shocks, that is percentages of these shocks faced by household. These include natural calamities, agricultural shocks, economic shocks, law and order, family matters, and health shocks. It is clear that a focus on health sector alone to improve health outcome is not good enough. The potential to address all these shocks or issues through comprehensive development initiatives fall within the rubric of social policy. What is social policy? A part of public policy that deals with social issues is central to politics and the affairs of the state and one of the major responsibilities of government. In public policy domain to formulate macroeconomic, foreign and defense policy, the social policy domain often remains fragmented despite the existence of individual components of social policy in health, education, environment, population, and other programs as in Pakistan. These are the different domains that come under social policy, like health, education, housing, environment, population. This is infrastructure, social protection programs, and income. All these are the conventional domains of social policy. Vision for a social policy. The key issues are Pakistan has range of policy instruments which constitute the individual element of social policy, including housing, labor protection, environment, education, health. However, it does not have an overarching and consolidated social policy embodied within a social justice framework. Pakistan's Social Protection Strategy by Ministry of Social Welfare stating that government's obligation is to chart a social policy has been fulfilled or by referring to social sector programs and delivery of services. In view of all these considerations, to develop consolidated and all-encompassing social policy embodied in social justice framework, to mandate overall responsibility for implementing a coherent policy to an organizational entity. Existing issues with current social service delivery arrangements merit urgent attention. Foremost is the need to bring clarity to the means of delivering social services. The base of existing social protection arrangements should be broadened. Then second reform is reform within the healthcare system. It includes policy reforms, institutional reforms, legislative reforms. Policy reform. The agenda for health sector reform articulated in the National Health Policy of 2001 has been subject of controversy because of major gaps and deficiencies in its formulation as well as its content, conceptually and programmatically. These include absence of contemporary and local situated vision to ensure health for all in Pakistan's health system, lack of attention in health system domains and intersectoral perspective. Third is disconnect from burden of disease and other pressing public health imperatives. Gateway Health Policy Scaffold. In 2006, Hartfield's Gateway paper and its health system-based conceptual design a new vision for health policy. Based on this framework, a multi-stakeholders consultation process led by the NGO was initialized. Consultations deliberated on the draft of the National Health Policy entitled the Gateway Health Policy Scaffold. The objectives of this scaffold included as guiding framework for health in the poverty reduction strategy paper 2 of Pakistan. The scaffold has been made available to the Ministry of Health to serve as a framework for the new health policy. The Gateway Health Policy Scaffold differs from previous policies with respect of 4 attributes that have been suggested for policy analysis. It includes context, content, actors, and process of policy implementation. The broad goals of the new vision and the envisaged agenda for policy reform and their respective strategies fall within the following 8 domains. These are evidence and information, health in all policies, health promotion, leadership and governance, health financing, service delivery, health workforce, and medicine products and technologies. The scaffold has attempted to bring coherence to a diverse set of issues while formulating health policy. As such, it remains a framework document and needs to be built upon further into tangible targets in planning instruments. Now, institutional reforms. Within Pakistan, agencies in health-related role include Federal Ministry of Health, the Provisional Departments of Health, Offices of Executive District Officers Health. Focus on following dimensions are there in institutional reforms. These are stewardship agencies, that is Ministry and Department of Health, decentralization, that is devolution of administrative powers, and organizational entities in relation to implementing or regulatory agencies. Then comes legislative reform. It includes overarching health legislation. Pakistan does not have overarching legislation in health. The need to explore the feasibility of promulgating a National Health Act in Pakistan in view of currently prevailing ambiguities in relation to administrative roles, responsibilities in a decentralized health system, and paucity of guidance on public-private partnership. Second legislation is public health legislation. It relates to the individual behaviors, society, or to safeguards and standards relevant to water, sanitation, waste disposal, accidents, injury, medical patients, epidemics, and other areas that need to be regulated and controlled in order to protect health interest. Third is health system legislation. It is related to governance, service delivery, health financing, human resource, health information systems, and medicines and related products. Fourth is personal and product liability litigation and legislation. In 2006, the Supreme Court of Pakistan observed a constitution relating to fundamental rights of human beings are given due importance. It is time to promote the law of tort so that people must understand that we cannot live as a nation without performing our duties within the framework of law. There are also some legislation broader context of consumer protection in Pakistan. Legislation of relevance to health is not fully developed in Pakistan. Reform agenda necessitates promulgation of laws which can enable the state to achieve its responsibilities of delivering health. To achieve this objective, health legislation must proceed in tandem with policy and institutional reform in health sector. The most critical challenge in health sector is not the absence of the law, but poor implementation of existing laws. Third is the reform agenda. Reform agenda is a set of actionable steps which can be implemented in a phased manner. Challenges in implementing a reform process in Pakistan can be summarized as country's political, law and order and geostrategic situation, current macroeconomic downturn which is being rescued by International Monetary Fund, country's public sector institutional culture, political considerations, tussles, and trade-offs which underpin the directions of reforms. No institutional memory or commitment to build on work in the pipeline and consolidate efforts underway. Successive governments tend to adopt options while subsequent governments disregard them. These systemic flaws underscore the need to address these challenges, no matter what the cost and how difficult the course. The reform agenda priority areas. There are five priority areas that are covered under reform agenda. First is multi-stakeholder, that is development partners, the establishment, civil society sign up. Second, it addressed broader constraints with the remit of political economy and inequalities of power, money, and resources. Third is increasing the base of public resources of financing for health. Fourth is market harnessing regulatory approaches have been flagged as a priority. Fifth is broader direction for reforming public and market service delivery arrangements should be complemented with the additional measures. The reforming agenda phasing implementation, it consists of 5 steps. First step focuses on 2 measures: developing a national consensus on the reform agenda. Second is increasing public financing for health. Second step includes bracing the health information system and pulling a thread through existing evidence. Step 3 encompassing 3 important elements: strengthening the institutional capacity. Second, honing norms and standards. Third, mainstreaming the use of technology in the health system. Step 4, it consists of implementing appropriate changes in existing pilots, prototyping in key settings to develop best practice models. And fifth step is should facilitate upscaling of prototypes. Implementation of multidimensional nature of reforms necessitate political will, perseverance, consistency of policy directions over time, resolve and capacity to cascade multidimensional changes into policies, laws, and institutional arrangements, limited capacity, short-term outlook of governments, lack of transparency in governance create amendments to institutionalization of these changes. Now, recent advances. This is an article on Punjab Health Sector Strategy 2019 to 2028. The government of Punjab taking forward the intent of newly elected political leadership to re-inform and restructure Punjab health sector towards better performance has pursued the development of 10-year Punjab Health Sector Strategy that is 2019 to 2028. This tragedy is a sequel and is inconsistent with the achievements and gaps falling out from the previous health sector strategy 2012 to 20 made as a result of post 18th Amendment of Pakistan bifurcation of Health Department Punjab. The outcomes and objectives that emerge through this consultative process are maternal and child health, nutrition and family planning, preventive health services including communicable and non-communicable diseases, patient safety and quality of care, medicine and biomedical equipments, health management information system, health governance and accountability, human resource for health, healthcare financing and public-private partnership, health disaster management and emergency medicine, One Health including environmental health. The situation analysis conducted prior to development of the health sector strategy shows that Punjab has several shortages in its basic indicators pertaining to RM and CHNN and communicable and non-communicable profiles. These all gaps have been dealt under this strategy to efficiently tackle these issues. Second, this is a report on COVID-19 to increase urgency of healthcare sector reforms in Pakistan for solutions. According to it, the government is making efforts to improve the healthcare system in Pakistan and has undertaken several reforms which will take time to deliver gains. Pakistan is striving to achieve universal healthcare access to quality essential health services with a specific focus on vulnerable groups. Government efforts to speed up reforms in the public health sector healthcare sector will lead to improved healthcare accessibility as Prime Minister Imran Khan relaunched the first phase of the health insurance scheme in February 2019, which had been introduced by the previous Pakistan Muslim League government as Prime Minister National Health Program in 2015 under the new title of Sehat Insaf Card. Under this program, vulnerable families can benefit from free treatment up to over rupees 7,20,000, usually in 150 government and private hospitals. The Ministry of National Health Services regulations and coordination under the leadership of Federal Health Minister has completed an important step to expand the ambit of social health protection initiative, that is Sehat Insaf, to poor families across Pakistan. It is expected upon completion of the program, a total of 40 million families will be enrolled in the scheme. There are numerous weaknesses which will affect the sector's development, including poor governance, lack of access and equal resources, poor health information management system, corruption in the health system, a lack of monitoring and health policy and health planning, and a lack of trained staff. Healthcare standards in Pakistan remain poor by global standards, with 78% of the population paying for healthcare expenditure out of pocket. Additionally, Pakistan has one of the lowest densities of health workers in the region and globally, with the doctor to patient ratio of 1 to 1300, doctor to nurse ratio 1 to 2.7. With such low levels of staffing, Pakistan is listed as one of the 57 countries with a critical health workforce deficiency. Now time for MCQs. MCQ number 1. Success to reform in the healthcare system is dependent on number of factors within and outside the healthcare system. What is healthcare reform? Government bill to make sure children always receive healthcare, keeping healthcare affordable, accessible and high quality, making healthcare free for the public and providing medications, focusing on disease prevention so the public can reduce healthcare costs.
Delta.
D.
D.
D is the right answer. MCQ number 2. Structural reform of governance and system of social welfare are important adjunct to reform within the healthcare system. Name 3 trends in healthcare reforms. Keeping health insurance private, offering free medical screening and reducing costs, streaming healthcare, keeping the public informed and focusing on disease prevention, enhancing technologies, getting rid of specialists and making medications affordable, keeping up with workforce shortages, offering pay for service plans, and cutting out consultation fees.
B.
Yes, B is the right option.
B.
That is streaming healthcare, keeping the public informed and focusing on disease prevention. MCQ number 3. Health reform is not a sectoral phenomenon. In addition to health-related policy, regulatory, institutional, and legislative measures, which of the following better management create additional fiscal space to spend more on health? Effectiveness of governance, social sector processes, macroeconomic management, political will.
Political will.
B.
E is the right option.
D.
Macroeconomic
Social.
management. MCQ 4. To promote fiscal transparency in order to decrease pilferages from the system include all except tax reforms, trade policies, promotion of foreign remittances, school health services, legal institutional measures.
D.
Yes, D is the right option. School health service is not the right option. MCQ number 5. Health has a direct correlation with poverty, illiteracy, and inequities in society. Well-established best determinant of health status achievement is the level of indices related to population, indices related to hospital, per capita income, environmental conditions.
B.
Per capita income.
C is the right option, per capita income. This is the best determinant of health status achievement. MCQ number 6. In mixed health systems, roles are played by public and private providers. It covers 41.73 million or 26.62% of country's population. Remaining 73.38% of population is not fully covered for health and seeks care by insurance, out-of-pocket expenditures, reimbursement.
Out of pocket expenditures.
B.
Beta.
Out of pocket. B.
Yes.
Out of pocket.
B. Out of.
MCQ number 7. Despite of existence of mixed health system, Pakistan failed to achieve health for all. The failure is due to the interplay of following determinants except inadequate state funding, burgeoning unregulated role of private sector, lack of transparency in governance, excellence in professionalism, unethical marketing practices.
Delta. D.
Yes,
D. D.
yes. MCQ number 8. Scaffold presented a vision for reforming Pakistan's health system. and attempted to outline directions to change. Given below are all included in it except structural, programmatic, political, institutional, legislative.
D.
Yes,
Institutional.
D.
Legislation.
C is the right answer, political.
Institutional.
MCQ number 9. Everyone has to work for the welfare of people of Pakistan, but a person who is violating the law and constitution works against the welfare of people must understand that everyone should perform duties within the framework of law, and it is high time to promote law of ordinance, law of tort, law of contract, law of judgment.
A.
D. D.
B, law of tort. Yes, right option is B. MCQ number 10. Which of the following legislations related to individual behavior, society, or to safeguards and standards? Relevant to water sanitation, water disposal, accident, injury, medical patents, epidemic, and the areas that need to be regulated and controlled in order to protect health interest. Overarching legislation, health system legislation, public health legislation, personal and product liability legislation.
C.
The right option.
D.
This is the key of MCQs.
Thank you very much, Dr. Meha. Very nice presentation, very well elaborated things, and especially the topic was very informative. And I hope everybody has learned a lot today. As there are no questions in chat box, so I think everyone is having a very clear concept of today's presentation. Thank you very much. See you next time, inshallah.
Thank you, ma'am.